Hi guys, today we're going to be talking about Sturge-Weber syndrome. So what is Sturge-Weber syndrome? It is a rare neurological and vascular disorder that is present at birth. It is characterized by a specific facial birthmark called a port wine birthmark, as well as abnormal blood vessels in the brain, eye abnormalities, and more. This disorder exists on a spectrum as symptoms vary from individual to individual. This disorder may also be classified as a neurocutaneous syndrome or one of the phacomatoses. These are terms for groups of disorders where growths seem to develop in the skin, brain, spinal cord, and other areas. For Sturge-Weber syndrome, these growths are malformations of abnormal blood vessels. And as seen in the picture below, we can see what the facial birthmark or the port wine birthmark would look like. Causation. Causes of Sturge-Weber syndrome involve somatic mutations, most commonly in the GNAQ gene. This mutation happens randomly and unknowingly. It is a somatic mutation because it occurs after fertilization of the embryo takes place. Affected individuals will have normal genes and others with abnormal ones, which create different ratios of healthy to abnormal genes in those with SWS. These different ratios account for differences in symptoms of Sturge-Weber syndrome. The GNAQ gene is responsible for creating G proteins, which play an important role in regulating blood vessels. In those affected by SWS, there is an overactivation of downstream pathways to these proteins, which causes hyperactivation and leads to congenital vascular abnormalities. Along with mutations in the GNAQ gene, there are also several other somatic mutations associated with Sturge-Weber syndrome, including gene mutations in GNAQ, GNAQ11, and PIK3CA. And down below in the picture, we can see the developments of the birthmark and the developments of abnormalities under the skin. Symptoms of Sturge-Weber syndrome. Sturge-Weber syndrome is sometimes broken into three main subtypes. This includes subtype 1, which can involve skin and neurological symptoms, and people may or may not have glaucoma as well. The second subtype involves skin symptoms and possibly glaucoma, but no neurological issues present. And the third subtype involves neurological issues present, but no skin abnormalities and no glaucoma. This type is also known as the isolated neurological variant. There are many different symptoms of Sturge-Weber syndrome because it is a highly variable disorder that is specific to the individual. The most notable symptom is the congenital facial birthmark, which is caused by a capillary malformation. This birthmark may range from light pink reddish to dark purple and also varies in size. In some cases, it engulfs at least one eyelid or the forehead of one side. The port wine birthmark is caused by an overabundance of capillaries just below the surface of the skin. If untreated, these birthmarks can deepen in color and possibly develop into blood blisters that may burst and lead to spontaneous bleeding. Size and distribution of blood vessels that make up the birthmark vary, meaning each individual's birthmark is unique from one another. Neurological symptoms of Sturge-Weber syndrome. There are many neurological effects of SWS, which also vary based on the individual affected. These neurological effects are caused by abnormal malformations of the blood vessels on the surface of the brain. One of the significant symptoms of this disease are seizures, which may begin in infancy or during childhood, and they vary in frequency and intensity, but sometimes worsen with age. Furthermore, muscle weakness or paralysis on one side of the body, typically opposite the brain involvement and birthmark area, may occur. Developmental and intellectual delays and disabilities are other common symptoms, which can range from mild learning disabilities to severe cognitive deficits. Headaches, migraines, visual field effects, risk of strokes or stroke-like episodes can also take place. Behavioral issues such as attention deficit disorder, ADD, and mood disorder and poor social skills are also known to occur in those with Sturge-Weber syndrome. Other symptoms of the disease. Other symptoms, mostly physiological ones, including glaucoma, can commonly manifest with Sturge-Weber syndrome. Glaucoma causes increased pressure within the eye and usually affects the eye that is on the same side of the face where the birthmark is present. Other eye abnormalities can also occur, such as hemangiomas, which are abnormal blood vessel tangles that developed in the choroid, the blood vessel layer at the back of the eye. Certain endocrine disorders have also been noted to be linked with Sturge-Weber syndrome, such as central hypothyroidism, increased risk of growth hormone deficiency, and more. Those with Sturge-Weber syndrome may also have an abnormally large head, an overgrowth of certain soft tissues, and lymphatic malformations. The affected populations. Sturge-Weber syndrome affects males and females equally and occurs in about 1 of 20,000 to 50,000 live births. However, the exact incidence and prevalence is unknown. 3 in 1,000 babies are born with the port wine birthmark, but only 6% of people born with the birthmark develop the neurological abnormalities of Sturge-Weber syndrome. Diagnosis. The process of diagnosing Sturge-Weber syndrome usually involves identification of characteristic symptoms, which include the port wine birthmark, glaucoma, cerebral involvement, and signs of neurological issues associated with the disease. Diagnosis of SWS is based on having 2 out of 3 diagnostic criteria, those being a racial port wine birthmark, increased ocular pressure, and leptomeningeal angiomatosis, which is a vascular abnormality associated with Sturge-Weber syndrome. Technology is used to help with the diagnosis process, such as the use of X-rays of the skull, MRIs, and CT scans to help identify neurological complications that may be present. Treatment for Sturge-Weber syndrome. Treatment for SWS does not follow a singular path of remedy. Instead, treatment is directed towards specific symptoms that are present in each individual, which again can vary from person to person. Treatment may involve efforts from pediatricians, neurologists, dermatologists, ophthalmologists, and more to address the myriad of different issues that come with this disorder. Laser therapy treatments are often used to lighten birthmarks, but this process involves repeated and long treatments. Seizures caused by Sturge-Weber syndrome are commonly treated with anti-seizure medications that are anticonvulsant and have efficacy in focal seizures. They are also commonly prescribed glaucoma medications. There are also a number of surgical techniques that can be employed to control seizures, although they are pretty invasive and can result in many adverse side effects. A few of these involve a hemispherectomy, a local cortical resection, and vagal nerve stimulation. And that is all I have on Sturge-Weber syndrome. I hope you enjoyed this presentation and you found it informative.